Creation of Community Migrant Health Centers.
And so we're part of a collaboration of different nonprofits and government agencies. It's a Washington Resources Group. So our collaboration includes the State Department of Health and then HRSA as well. And so, and then the, what's
Oh, there's Washington
Yeah.
Washington Student Assistance.
So pizza's provided by our donors. So thank you. So just quickly, here's what we're going to talk about today. Go into a little bit about Washington state demographics, and then look at the safety net, and then go into loan repayment programs and scholarship programs, as well as the resources we have available from our organizations. But just sort of for us to get a sense of who's here, we're hoping maybe we could go around the room and you could give your name, what year you are in your studies, what you're focusing on, if anything.
Other than getting help.
Yeah.
My name is Nicole Milliron. I'm in the AGNP track. I'm my second year. And so far, not a huge focus.
Oh, and where you're from?
I'm from here.
Cool.
Yeah.
My name is Katie Silence. I'm in the AGNP track as well. I'm just applied to them. I do a free certificate, so who knows what will happen.
For some of us, what's AGNP? I'm
Oh,
sorry.
adult geriatric.
Thank you.
Yeah.
I was thinking it might be, but thank you.
Sorry about that. And I'm really interested in women's health. I moved out to Washington from Wisconsin, so I don't know if I'll stay or what the deal is, but maybe.
We'll sell you.
My name is Bill Hoskin. I'm a second year family nurse practitioner student. No clear focus at this point, but I like hospice and palliative care. So.
Okay. My name's Sally McPherson, and I'm a second year FNP student. I have lots of interests, so I haven't quite narrowed down just yet at this point. And I'm Washington born and raised, live in Skagit County.
Okay, cool.
From Atlanta.
I'm Gail. I'm a FNP student as well, and I'm from Maryland, and I want to do maybe rural health, I don't know, in family practice.
I'm Monica Meyer. I'm a certified nurse midwife student, second year, and I am from Arizona.
I'm Claire Shirley, also a nurse midwifery student. I graduate in June. And I grew up over in the Spokane area, but I've lived all over the country.
Over here.
Okay. Hi, I'm Morgan Dixon. I am a first year psych mental health student. I'm really interested in child, adolescent, and the homeless population from Texas.
I'm Bridget. I'm in a second year in the psych track. And I am really interested in working with homeless, mentally ill people, probably in an urban setting.
I'm Grace. I'm a first year psych NP student, and I'm from Leavenworth, Washington. And I'm not sure about my focus yet. Maybe something with child, adolescent, and maybe something trauma related.
I'm Sarah. I'm a third year FNP. I'm from Wisconsin as well, and I'm pretty sold on the Pacific Northwest. I have many interests, but I think primary care is where I'm going to be diving into.
My name is Chris Padilla. I'm from Pittsburgh, Pennsylvania, and I'm in that first year FNP program and looking at rural health, primary care.
Great.
My name's Sarah. I'm in the first year of adult geriatric track. Yeah, thinking primary care afterwards. I've been in Seattle for about 2 years now, but I'm originally from Denver.
I'm Shannon Porter. I'm a second year FNP student, originally from Vancouver Island, Canada, married to a retired Navy, so I've lived all over and this is where we're staying. Hoping to focus on primary care.
I'm Rashay. I'm a third year AGNP student and focusing on primary care.
My name is Mara. I'm a third-year F&P student. My interest is community health and local health, and I'm from Colorado.
My name is Masa. I'm from Japan, and I'm a PhD student in last year, hopefully, but you never know. I'm interested in actually effect of loan repayment program in primary care healthcare students. So I'm here for different reasons, perhaps. I want to learn. Maybe all of you might become my subject.
Yeah, dissertation.
All right, well, thanks for introducing yourselves. Always cool to see the different demographics of where people are from, what they're interested in. All right, so to start with, looking at what is rural in Washington State. So it's not as easy as you might think. Some of the places up in the Cascades count as urban on this map. And actually, according to the federal government, there are 15 different ways you can define urban or rural, depending on what your specific purpose is. So this map here is just one example. This was developed by the UW, looking at where people commute from. So even if you live in like Gold Bar or some small town up in the Cascades, because most people commute down to Everett, Seattle, Bellingham, they count as urban because they can get urban services. So it's not always what it might seem for looking at working in rural health. And just a quick hint, it's usually not an hour from Seattle. So on to underserved populations. So this is Washington State by the percent low income. So, and on here, low income means 200% of poverty. Any of you guys know what that means in income per year for a family of 4?
Is it like 30,000?
All right, we got one guess, 30,000.
18,500.
All right.
For 200%?
So 30,000 for a family of 2. For a family of 4, it's 47,000. So it's actually 200% of poverty is a lot more than a lot of people imagine, but it's still really hard to have a family and do everything you need on that. So other than just low income, what are some other medically underserved groups that we could talk about serving and that can qualify for working in loan repayment for working for these groups or anything like that? Do you have any ideas?
Migrant populations.
Yeah. Yeah, definitely. That's one that actually a lot of people skip over. Yeah, oh yeah.
LGBTQ population.
Definitely.
What did you all say over there?
I said LGBTQ.
Yeah.
First Nations.
First
Oh,
Nations.
okay.
Yeah, I like that term.
All very true. People that are on Medicaid or Medicare as well. So now looking at Washington's racial demographics, which are actually pretty interesting, because Washington, we're actually whiter than the average U.S. state, but we have more Asian population, a larger Native Hawaiian and Pacific Islander, as well as First Nations and people who report more than 2 races, or 2 or more. And one of the really interesting things is we have actually less Hispanics in Washington State than the rest of the country, but if you look at this map here, you can actually sort of see some of the areas that have heavy Hispanic populations. In central Washington especially, there are some counties that actually have more than 50% Hispanic populations. Up in the Wenatchee area, there's a very large Hispanic population, and then down here where you've got orchards, farming, a lot of migrant communities. Oh, do we? I wasn't sure. Oh, oops. Yeah. Yeah.
paints a good picture.
Yeah.
And we even have some Spanish-speaking populations on the west side with that darker orange, and a lot of those individuals are either planting trees or out in the floral industry, picking salal or ferns from the floral industry, so people forget about those. Or if you look at Skagit County, there was somebody from Skagit, yep, you'll see a little dark orange up there as well.
Yeah. It can get really interesting in central Washington with communities that are so heavily influenced by undocumented populations, where you see towns like Mattawa, Washington, where the mayor was elected by 42 votes just because nobody can vote because everyone's undocumented.
I just have a quick question.
Yeah.
Just get my perspective of where we are. Where is like Washington or Seattle on that?
Okay, so Seattle is in King County, so right about here.
Yeah, plenty on Skagit County.
Yeah. So Skagit is right up here.
If you've been here long enough, you've heard about the Tulip Festival every spring in Skagit County.
Yeah.
With those populations working in there.
And then you have up here
Wenatchee.
Chelan, Wenatchee, and then Yakima,
And
Tri-Cities.
Down to the Tri-Cities, and actually down in the southeast corner is Walla Walla area.
So onions, like onions, wine, lot of
Onions, wine,
agriculture.
orchards, yeah.
Yeah. All right. So now to go on to the 4 main safety net access points. So we have community migrant health centers.
And I'll be talking more about that in a while. We do provide medical, dental, mental health services. We have clinics in both rural and urban areas, and they have some clinics have a focus on special populations like migrants or American Indians, Alaska Natives, etc.
And then we've got critical access hospitals, tribal health sites, and rural health clinics. So community migrant health centers, critical access hospitals, and tribal health sites are all federally qualified health centers. And then rural health clinics are a different federal program that have a lot of the same benefits, but they're a little bit separate as well. So all FQHCs get certain benefits, and if you choose to work for one of them, you see those benefits. You get medical malpractice coverage through the federal tort claims law. You get medical, cost-based reimbursement for services under Medicare, which is a bit different than if you're working at a large hospital in Seattle or private practice, because especially at critical access hospitals, tribal sites, and rural health clinics, you might not have the volume that those places rely on in urban areas. So the federal government, in order to preserve the safety net in rural areas, has provided this alternative form of reimbursement. The critical access hospitals are really interesting in Washington State in that there are some that are very large, places that do fill up 25 beds on a frequent basis. They have, sometimes in the case of like Pullman, Washington, a large endowment. But there are other critical access hospitals that their daily census is usually 3 patients. So they're more of a clinic than a hospital for a lot of people, what they would think of. And rural health clinics can be public or private. So you can have a for-profit rural health clinic. But more recently, a lot of rural health clinics are partnering and becoming part of the network with the critical access hospital near them. That's what we're seeing a lot of now. And then tribal health sites can be different depending on what tribe. So some tribes choose to run their own clinics, and then some tribes choose to have Indian Health Services through the federal government do it, which means working for a tribe serving people who are First Nations could mean that you're a federal government employee or a tribal employee, which has very different implications for everything, because tribes have special rules around employment and what they can and can't do with employees.
Oh, my turn. All right, I'm going to go to the next slide. I'm going to talk this next section about resources available to all kinds of different disciplines, including nurse practitioners. And the first one I'm going to talk about is going to be very short and very quick. And that is two programs. They're scholarship programs. It's basically committing while you're still in school. There's the National Service Corps Scholarship Program and the Nurse Corps Scholarship Program. And I do have the websites here if you want to go and learn more about both of these programs. I will say, though, that the National Service Corps Scholarship Program, even though it includes nurse practitioners, it does not include nurse practitioners with doctorates. So I don't know if that's going to affect anybody and anybody's interest here, but that's just one of the things that they haven't quite gotten on the bandwagon with DNPs yet. The Nurse Corps Scholarship Program, which is also through HRSA, does include the DNPs, but there's a prioritization as to who gets the awards in that particular program, and I believe the DNP category is a priority, maybe lower than some of the others in the master's level, etc. The fear being that DNPs aren't going to do primary care, and a lot of times the focus of these training programs is to make sure people are interested in primary care and going out and working and doing specifically that in underserved areas across the country. And I know that's the case with the National Service Corps Scholarship Program. So if you are interested in, I'm just going to say this right now. You and I've got a few more slides, but we're going to just zip right through them. Is it right or left? Left.
The other one.
So if you're interested, please take a look at those. The NHSC Scholarship Program is a minimum 2-year commitment. And provides tuition and covers your books and fees, and also has a living stipend. The scholarship tuition portion and books fee portion is not taxed, but the living stipend is. The Nurse Corps, and I'm less familiar, I have to just say it, I'm less familiar with that one, to be perfectly honest. It used to be called the Nursing Education Loan Repayment Program, so whoever went on to the HRSA website, it was formally called that. I'll just let you take a look at that on your own. So then there are 3 programs that provide loan repayment for clinicians that I will dive into. One is the Washington State Health Professional Loan Repayment Program. The other are state programs. These are committing after you're done with training. It's assumed that you've taken out loans while you're in your training to cover the cost of that. And there's a Nurse Corps loan repayment program. You can apply to these state or federal programs, but you can only receive funds from one of them, no double dipping, and they do talk to each other, and they will find out if that is in fact happening.
But we highly encourage, if you are interested
Yes.
in getting one, apply to all of them that you're eligible for, and just only accept one.
So getting into the details a little bit more about the Washington State Health Professional Loan Repayment Program. Here's their website. These are the eligible providers. I looked at their website again this morning because I wanted to get clear on whether this whole thing with DNPs is acceptable to them, and I couldn't find anything there, so I'm going to make the working assumption that DNPs are in fact okay, as long as you qualify for everything else as far as your eligibility requirements are concerned.
Just a quick question, do you have handouts with the websites or anything like that?
Yeah.
Okay, just taking notes.
And I can also, should I just send their presentation to you afterwards? We can then just kind of, blanket email it from there. That's another way to do it.
That would be great. Thank you.
Yeah. For the Washington State Health Professional Loan Repayment Program, once you are out there and working, they expect you to work a minimum of 40 hours a week. 32 of those hours are in direct patient care. The award itself is up to $35,000 a year for years 1 and 2, so you get $70,000. That's up to, all depending on what your actual debt load is, etc. You can get extensions to those contracts. Right now, they're able to provide up to $20,000 per year for an extension to that contract if you continue to have eligible debt and you continue to work in the underserved area. The basis for making those awards is what's called a health professional shortage area designation, and has anybody heard that term before? HPSAs. Quick tutorial on what that means. There's 3 kinds. There's a primary care HPSA, mental health HPSAs, and dental. Nurse practitioners fall into the primary care one. It's a federal designation that looks at all kinds of different factors for each one, like distance to the next nearest source of care. For the primary care one, they look at infant mortality rate, that kind of stuff, and all factors into a score. And the higher the score, the greater the need. And the scores range from 0 to 25. And the reason I'm giving you all this is because I do have some slides later on that will get into the weeds a little bit more about scoring and what that means. But for the Washington State Loan Repayment Program, they just want you in a HIPSA. They're not really worried about the score. So I'll just leave it at that. There is a site approval process that goes on for the individual sites themselves that want to get the Washington State program. That process happens in the fall each year, and then in January, the state releases the list of opportunities. That list is now available on their website from all over the state. And you have to have your application, and the provider application is due by the end of April. And you have to be able to start working by July 1, which doesn't give you a lot of time off if you just graduated. So we oftentimes will say, you know, look at this program. Maybe the best thing to do is to go and maybe find someplace that you'll be happy with as a job, and then you're there for a year and apply later on, because if you are unhappy and decide after 6 months of being there that this isn't for you and you're stuck in a contract, that sometimes can be defeating for both you and for the site. So think about that, and also because of this squeeze on July 1, it's oftentimes just better to maybe think about it for a year down the pike. Yeah. So the state will start providing that payment back to you. They pay in quarterly payments. It goes directly into your account, and then they verify that you're actually still there and doing what you said you would be doing on a quarterly basis during the length of your contract.
One of the things, if you do get one of the loan repayment things, when you get a payment, you shouldn't let that money sit around or try to invest it or something temporarily. They check to make sure it went in, and we actually a couple years ago had a student who got it and then went through a messy breakup with her husband, who cleaned out the account and took that money, and she was still obligated to put it towards her loans.
Mm-hmm.
So,
yeah. Lessons learned.
Yeah.
Take our advice. And then once this bottom comment is, once you are there and working in a shortage area, if for some reason, because HIPSAs are reviewed on a like every 3 to 5 year basis, if for some reason that HIPSA has been pulled by the federal government, you continue to work there, you're fine. We don't have to move you, you'll finish out your contract, and that's what that little comment means.
Did you say this was available for primary care and for psychiatric nurse practitioners?
For the, yes, hang on a second. I could probably even go back. Here, thank you.
yeah, there's
Yeah, psychiatric nurse practitioners, yeah.
Excellent.
Yeah.
Thank you.
I was here, I wanted to make sure. So now we're talking about the National Service Corps Loan Repayment Program. And these are the eligible providers again. Certified nurse midwives and primary care nurse practitioners and psych nurse practitioners with master's degree, postmaster's certificate, or doctoral degree. You can actually get an award for working full-time or part-time. That's one of the nice things about the National Service Corps Loan Repayment Program. If you work full-time, they expect you to be working 40 hours a week, 32 of that again in clinic. The part-time option is 20 to 39 hours a week. That has been really attractive to a lot of folks that are just getting out of all these multiple years of training that they've been in, and they may have young families and they just want to kind of have a more balanced life after they get out of school. This comment about HIPSA score varies. I'll get into that in a minute. And with continued service after your initial 2-year contract is complete, you can get an extension to your contract. Again, it's all dependent on the funds available that year, but I haven't heard of the National Service Corps saying no to anybody who wants to continue their contract. assuming they still have eligible debt. The whole idea is you're still providing services in an underserved area where it's really needed, and that's the whole goal for the program and for the use of the money.
So one of the things on this that might be interesting to the psychiatric folks is this last year, the federal government awarded a lot of National Service Corps loan repayment to behavioral health providers. So we don't know if that'll continue,
Yeah.
what'll happen next year, but
Yeah.
this last year, that's what
Yeah,
happened.
yeah.
Like it's underfunded.
Yeah. The site approval process for the National Service Corps loan payment, there is a site application for everything except community health centers. Community health centers and tribal sites don't have to do that. The reason for that is because we know they're serving the underserved. Whereas other clinics or organizations that may be in a health professional shortage area do have to submit an NHSC site application. The provider application is due out in January, and I just looked again before I left. It's still not out, but we're hearing that it will be coming out for this particular 2015 cycle. It'll be out soon. I think the deadline will probably be March or April. I'm not 100% on that. If you are interested in any of these programs, you can always go to the National Service Corps website. They have an option where you can put in your email address to be notified when things come out. I've done that, and I get these pop-ups, and it's there, and I know what's going on. Each one of these programs have a detailed loan repayment guidance that comes with it. It's like a Bible. Read it before you decide to submit, because you should have a thorough understanding of what that commitment is all about and all of the eligibility requirements. The federal government runs on this fiscal year of October through September, so they have to spend all the money by the end of September. So generally when applications are going in the spring, they're doing their thing and trying to see who's going to get the money, and then they send out the money, and it all has to be spent by the end of September. All right. So now we're going to get into some really interesting stuff. The National Service Corps award amount depends on the health professional shortage area score, or the perceived level of need. Under the 2014 guidance that just came out for this past year, we haven't seen the 2015, that's what I'm waiting for right now. Any site that had a 14 or higher HEPSA score and you were working a 2-year initial contract, you'd get up to $50,000, so it's a little less than the state 2-year contract. If it's half-time, it's obviously $25,000. And then up here it says sites with 0 to 13 can get up to 30 or 15, and I'll talk a little bit more about how they make those determinations of who's actually going to get the awards in a second. What they do is they do that by going down basically the HPSA scoring gradient. So they have a bunch of money available every year from the federal government to spend, and then they say, okay, here's all the applications from HPSA scores of 25. And 24, and 23, and 20, down. This past year, for the 2014 that just ended this fall, they were only able to get down to scores of 15. They didn't even get to 14. So they have in their publication, you can get up to 30, but you probably, if you're at a 13 site, there's a good chance you won't get it, because they just have such a demand on this program from across the country, and they are legislatively mandated to give it to the highest need places. So just FYI on that one. And that's why it's another good idea to get your name in to get that notification if you are interested in this program, to see what's going to be for this year. The Nurse Corps Loan Repayment Program, formerly known as the Nursing Education Loan Repayment Program. I did mention a little bit ago, they do include doctoral, and they have a priority way of deciding who's going to get that, and I understand from talking with our WRG counterpart, who's unfortunately couldn't be here today, she works for the Department of Health here in the state. She says that they have decided that doctoral nurses are down the priority scale. You have to serve at least minimum 2 years in what they call a critical shortage facility. They don't use the HPSA so much with the Nurse Corps program, but they have this critical shortage facility. And you have to be working again pretty much full-time, which is at least 32 hours a week. The critical shortage facilities, here they are on the left. It's a real long list of places. You can be at a community health center, you can be at a tribal site, You can be at a home health agency, a nursing home, critical access hospital, etc. There's a lot of them. So what do you get for your award? It's the first 2 years, it's 60% of your total qualifying loans. And that can go up to an additional 25% for a third qualifying year. The notice for the Nurse Corps program just came out last week, and I just shared that with all my community health center folks in case they are talking with nurses who might be interested in this. There are a couple of webinars coming up, one this month and one in February. If you're interested, I would recommend you definitely participate in one of those webinars. The application deadline is February 26th for this particular program.
Can you apply for those while you're in school?
Say that again.
Can you apply for those while you're in school? Or you need to be graduated?
I think you need to be graduated and working at a facility that qualifies.
That's what let me just talk. I know the NHSC program better than I know the Nurse Corps, so I just have to.
I just read that.
The National Service Corps loan repayment. If you're still in school in your last year of training and you're at that point where you want to find a job, and you have found a job even though you haven't finished yet, and as long as you can start that job and you're licensed and accredited and yada yada yada, and there's a potential for loan repayment, yeah, you can apply that here.
Okay.
However, kind of going back to what I said a little bit earlier,
Right.
6 months into it,
Right.
you may or may not like it.
Right.
Just kind of keep that in mind, but it is possible. The Nurse Corps, I'm less sure. I'd have to look at the detailing in their guidance. There's only so much my brain will hold these
Sure.
days.
And you said the DNPs are not prioritized?
For the
Nurse Corps.
For the Nurse Corps, they are prioritized for the NHSC. For the NHSC scholarship, or excuse me, NHSC loan repayment program. I don't believe. I think it's just based on HIPSA. Higher prior, higher scoring HIPSAs. So as long as you're doing, and I will say most of the opportunities, if you go to the National Service Corps website, that are approved for loan repayment will be for someone that's actually doing patient care, probably not admin. That makes any sense.
But if you're doing patient care as a DNP, you probably would not be prioritizing the Nurse Corps.
For the National Service Corps, for this one, you probably would be, as I understand it. That part is, again, a little not clear to me, so I recommend you go to their website and take a look. Yeah, sorry about that. So what's the likelihood of receiving an award for the National Service Corps? We talked a little bit about this already. It's your application with the high score equals an award. In 2014, Washington had 102 awards for folks that applied for the NHSC loan repayment, and a majority of those did go to the mental health. And I think the reason for that is, as I said, every HIPSA has a score. And right now, it seems like the mental health HIPSAs have higher scores than the primary care HIPSAs. And I don't know if it's going to play out like that this next loan repayment cycle for the National Service Corps. It'll be interesting to see. I know that, and that's actually, nationally, I think they got more, the mental health got more than the primary care, which, for the docs, everybody else out there gets all ticked off, but that's the way it goes. I just don't know how it's going to play for 2015 at this point. For the Washington State Health Professional Loan Repayment Program, it was your application, a site application, which equals award. And in 2014, and this is kind of an interesting slide because it kind of shows you the funding available for the state program versus the federal program. There were 25 new awards, 7 of those went to physicians. Well, why was it so few? Well, if you all remember, Washington had a real budget crisis 3 or 4 years ago, and they lost funds 3 or 4 years ago for the state program, so they don't have as much money. And to get out in new contracts. The Washington State also has a scholarship program, and the same is true for them. They don't have any money at all right now to provide scholarships. The money that they get for loan repayment is actually a matching dollars, state dollars with federal dollars from the National Service Corps. That's all they have. And right now there's a real big effort afoot amongst all of our respective organizations to try and reinstate the funds that they lost 3 or 4 years ago with this particular legislative session that just started. Obviously the jury's still out, the legislature's just getting their feet warm with all that's going to be happening this year. So I really don't know if we'll get that money back or not. We pushed for it last year, and we're pushing again this year. We've asked for $8 million which will support another 100 and some folks through loan repayment. We'll see if it happens. So some common pitfalls to avoid when you're going out for all of these things is consolidating any eligible debt you may have with an ineligible debt. Don't do it. Kind of as a subcategory to that one, don't consolidate your debt with anybody else's debt. Doesn't look good either. I'm not sure this applies to you guys. I know it can apply to some of the medical students. Primary care loans are not eligible. Private loans through Aunt Gracie are not eligible. Usually it's just commercial bank loans and or federal loans that are eligible. Signing bonuses. What is a signing bonuses? Signing bonuses are where you might enter into a contract with a location that says, well, you know, if you stay here for a certain amount of time, blah, blah, blah. We'd like you to stay here for a certain amount of time if you signed to stay there. Well, that is a previous commitment in the eyes of the National Health Service Corps, and that will kick you out. So it's kind of an odd duck kind of thing.
There have been some students that have sort of worked with their places that they got National Health Service Corps, wrote into their contract that I'll do the signing bonus if I don't get National Service Corps, or you'll provide this money without an obligation if I get National Service Corps, stuff like that, just flexing the contract around so that it works for the loan repayment program.
Thanks, that's true. Not applying, we talked a little bit about this. With the National Service Corps loan repayment program, they pay once on an annual basis, so it's a huge chunk of change that'll land in your bank account, and it's up to you to pay off your loans, and then they will continue to verify that you're still there doing what you said you would be doing, and you have to show proof that you've paid down your loans. So going out and buying a car is not going to be a good thing to do. So apply those funds to your loans as you get them. One of the things that we heard kind of anecdotally was that a lot of applications were being kicked out because people were submitting their driver's license as proof of citizenship. That won't work either. So just FYI. I'm going to turn this one over to this particular slide over to Zach because he's got lots to say about public service loan forgiveness.
So sometimes employers assist with loan repayment, so that's noted. You've got to remember that's taxable as income. Really depends on your contract and if you can get that negotiated in there. And then public service loan forgiveness. How many of y'all are thinking about this as an option?
Have you heard of this as an option?
Yeah, so it's really worthwhile, pretty much especially in healthcare, because even the very large healthcare conglomerates often are classified as nonprofits. And by working at a nonprofit, you can qualify for this program. And it's not something that you really apply to and get accepted or rejected for. It's based on if you're doing public service as is listed on the federal loan repayment website. And it's specifically for federal loans, so like Stafford, Perkins, stuff like that. So you won't get your Sallie Mae loans taken care of on this. And the way it works is every year you have to submit paperwork showing where you're working, proving you're working there. And after 120 payments or 10 years, the remainder of your loan balance will be forgiven. So it can be...
But you have to work full-time 10 years straight.
Yeah.
Can't be
But
breaks.
I think...
And it has to be full-time.
Yeah, I think you can take breaks, but if you take breaks...
You can, but you have to pick it up.
You have to pick it up, so you'll have to make more payments later.
Subtracted.
Yeah.
I think full-time is 32 hours a week.
I don't know that off the top of my head.
But,
yeah.
If you look, it's through the Department of Education, which is Health and Human Services.
It's sort of complicated as well because money has never been paid out through this program.
Yet.
It was created in 2007, so the first people who are going to get benefits from this are in 2017. So there's a lot of talk about how the federal government might change this when it starts costing them money. One of the things is a lot of legislators sort of, their idea behind this was for teachers that have $50,000 in debt. We're going to take this out and pay it back. Not so much that doctors and medical professionals that make lots of money would be using this program. So they've talked about changing it for future people that apply and do this, that you only get to eliminate a certain amount of debt at the end. But that hasn't happened yet.
So is this the one that they like change your loan payments to like a percent of your income
Yeah.
versus
No,
like
it's
just
different.
your?
Well, it's different. Yeah,
Okay.
That's income based.
that's income based, and that will just extend your repayment. This, I don't remember exactly how they look at that.
To qualify,
Yeah.
you have to be on an income-based or income contingent plan for the payments to qualify for this one.
Okay.
So the two go together.
Yeah. If you're not doing public service loan forgiveness, the income contingent can mean you'll be paying your loans for like 25 years or 15 years.
Yeah, the interest accumulation is
Is
interesting.
a lot. Yeah. It's
Well,
tough.
if they don't, if in 10 years we don't know if they're going to be paying it or not, and bank on that.
Yeah.
And then not
It's
know.
definitely
To me,
not-
nerve-wracking.
Yeah, it's not as good of an option as National Service Corps or Washington State Loan Repayment if you can apply and get that, for sure. But it is an option out there.
And I think a lot of financial aid offices have kind of been brought on board with this and maybe talking about it a lot. When people go and apply for financial aid.
And you said yearly you have to,
Yeah, yearly you have to submit information that you're working for X nonprofit that qualifies, and get that signed off with HR. There's paperwork required that you have to submit for every year documenting that you're doing this. It's really hard, like 10 years is a long time, a lot of people switch jobs.
yeah.
So you don't
And
want
it
to.
has to be done annually even if you don't switch a job.
I believe it has to be done annually.
Okay.
Like, it's something that you can't just say, oh, I'm going to do this, and then 10 years later start filling out the paperwork. That's a terrible idea. Yeah.
I have two questions. My first one was, you said the other two programs besides the Nurse Corps, that is not taxable?
Yeah.
Washington State Loan Repayment Program and the National Service Corps Loan Repayment Program are not taxed.
Okay.
We have Senator Campbell to thank for that.
Thank you. My second question is, are there any implications for your salary, or do people run into that?
Good point, good question. The National Service Corps says that you should be paid whatever the market is for that particular discipline in your area. You're not to get a lower salary just because you get loan repayment. So you get your salary plus loan repayment. Yeah.
Do you have a sense of, it's kind of hard to tell, like, how popular this program is? Like,
Which
how
one?
many, well, either one, either the Nurse Corps or the, I mean, you know, I don't know, like, do
yeah,
10% of people get it? Or?
Well, I wish I could. We're just happy to get what little statistics we do get from the federal program about how many people we actually got awards in Washington. I don't have a percentage. The national office may have that, but I don't have it. I'm not.
I think I'm just wondering if you have a sense of, like, if it has a high HPSA score and, you know what I mean, like, you meet all the qualifications, are you still sort of like?
It's not guaranteed.
It's not guaranteed, but there is a higher
just not
chance.
guaranteed.
Yeah,
it's just a higher chance.
The higher HPSA score you go for, it really increases your likelihood. Washington State Loan Repayment is a bit more complicated because they look at your application and the application of the site together holistically, or National Service Corps. They do look at a couple other things, but they really, really focus on that HPSA score.
Okay.
And I know that the National Service Corps programs, whether it's the scholarship or the loan repayment, are really highly in demand. I don't have a sense of this Nurse Corps, but I'm guessing that it probably is as well.
I can kind of speak to that. I applied for the scholarship, for the Nurse Corps scholarship this last year. And if you did not have an estimated financial contribution of 0, there was no way you were getting it. Like when you do your FAFSA, they give you an estimated financial contribution. It had to be 0, meaning that pretty much you can't be working in order to get the scholarship. And so I'm assuming it's probably similar.
Yeah. I don't think the NHSC, Laura came, I don't think they look at FAFSA or anything like that. Probably would be.
I applied for the one while you're still in school, the nurse corps one. I feel like there were like 2,200 applicants or something like that, and they gave awards to like 300.
That's probably, that's, thank you.
That was a couple years ago, and then I was like, never.
Okay, moving along. How does it open up here? We can just keep going. Okay. Just kind of let you know who else is a part of our group that is not physically in the room here. With the Washington State Loan Repayment Program, Chris is now the contact. If you do have any questions about the National Service Corps, there is an office here in Seattle, and Matt Feist is a Washington person. If you're interested in Oregon, there's an Oregon person, Idaho, there's an Idaho person, and Alaska, there's an Alaska person. We cover those 4 states. Zach is here. With the Washington Department of Health, we have Joanna Kane, who is the recruitment specialist. And if you are interested in going back to Wisconsin or any other state in the union, there's a program called 3RNet, Rural Recruitment and Retention Network. Joanna is the recruitment specialist for Washington through the 3RNet, and we do have information here. Basically, this is a national network where they list opportunities in primarily rural areas, but underserved areas as well, to the urban.
And the nice thing about this organization is it's a nonprofit. They're not headhunters. They're not going to email
They're
you a
not going to
million
call
times.
you.
They're specifically about trying to connect people who are interested in working in urban, underserved, and rural areas with those jobs.
And then along with Joanna is Renee Fullerton, also at the Department of Health. Renee and I just visited with the dentist last night, so we are doing a UW week. And I'm with the Washington Association of Community Minded Health Centers. I will pass these around. This is just general information.
We can start passing all
things
this
around.
out.
I do have a list of opportunities available at our 26 community health centers. There's not all 26 listed here, but most of them are. In King County, you may have heard of several of our community health centers. We have Country Doctors, Seattle Indian Health Board, Seymour, Health Point, Neighbor Care, Seattle King County Public Health, and International Community Health Services. And yeah, let's see.
Question, just to follow up on that salary question, I think you mentioned it for the HRSA, but does the Washington program also offer the same thing, or is it a little bit different?
I'm sorry, say that again, on the...
For the Washington program?
For the Washington program, do they do...
The same thing?
I'm sorry.
The HRSA program, you said it goes at market rate?
Oh, yes, it should be. Yes.
Right, and then we also would both have cards, so if you have further questions, you can definitely grab a card and contact us later.
A lot of the health centers now are starting family nurse practitioner residency training programs, and I've got a listing of those here if anybody's interested. Columbia Basin Health Association and a fellow Community Health Care in Tacoma, International Community Health just started one, and Yakima Valley Farm Workers Basin College has a family nurse practitioner residency training program. So this is a relatively new wrinkle, and yeah. Here you go.
For the nurse corps, any idea how it's prioritized?
You know, I looked at that, but it's a little more complicated than what I wanted to memorize. So I'm sorry I don't have that, and I didn't really need any detailed information.
Is that Matthew that was the contact?
Say that again.
Was that Matthew?
Matt?
We can still...
Not by...
He could probably talk about the nurse corps program.
For in-home
Yes. So, So in a world of healthcare access disparities, what can you do? We know all of you are not going to go work in underserved America or Washington, but you can certainly do your part anyway. There's lots of ways that we're doing that, like through volunteering. I know that the Department of Health has a great list of the free clinics throughout the entire state of Washington. You can always volunteer in a free clinic. You can try to do what you can to see uninsured patients in your practice, or Medicaid patients, or Medicare patients. And so even if you're not going to be going into any kind of urban or rural underserved primary care or nursing practice, you can be a part of the solution. So that's basically the final message you want to leave you with. Thank you all. There's more.
Yeah, and one last thing, just to thank you all for staying the whole time. I've got a $5 Starbucks gift card. So what we're gonna do is go around, and I'm thinking of a number between 1 and 100. The closest person to get it will get their free coffee tomorrow or this afternoon.